Hi, I'm Randy.
Hi, I'm Matt.
Hello, I'm Ryan Andres.
Today, I'd like to walk you through the steps of how I discovered my son having ADD, the symptoms, possible causes, and the steps to diagnose and treat this disorder. Attention deficit hyperactivity disorder, I'll refer to as ADHD, is a neurological disorder. It is the most common mental disorder affecting 3 to 5% of American children, according to the American Pediatric Association. Some of the common symptoms that my son include blurting out answers, fidgety, gets bored easy, impulsiveness, misses details through schoolwork, is talking out of turn, and gets bored easily unless they find the task enjoyable. Although studies have not found an definitive cause for ADHD, there are some likely causes. Heredity is the most common. My son has family on both sides that have ADHD. I have a cousin that has ADHD that was diagnosed when he was a teenager and is now an adult. On the father's side of the family, he has two cousins that have ADHD, and that was diagnosed about the same time. Another cause of this disorder may be from pesticides, even though more studies will have to confirm the link between these. Through my research, I have found experts say the studies are very persuasive. I was exposed to myethion in Florida. It's a chemical that treats and kills mosquitoes. Planes would fly over the town and trucks would come by through the neighborhood. Um, Pesticides showed up in the urine of 94% of children, according to Carla K. Johnson of the Huffington Post, May 5th, 2010. The last cause I will talk about is head injuries. This is the third most common cause of ADHD, perhaps due to frontal lobe damage. I did have a difficult pregnancy, and when he was 1 year old, he fell down the basement steps and hit his forehead, his face, and eyes swelled, but the doctor said he was fine. Now that I've informed you of the symptoms and possible causes, let's talk about how do you diagnose your child with ADHD. Testing is the first step towards prevention and treatment of additional disorders that may accompany it. A clinical evaluation is necessary, and several tests have been performed to diagnose this disorder. The first step my doctor did was a physical evaluation. Then he ordered blood tests. He did an electroencephalogram, which is the EEG. It measures and records electrical activity of the brain. Certain conditions and neurological disorders can be seen through the changes of the brain's electrical activity. After several tests have been proven inconclusive, the doctor moved on to the next step. What he did then was provide Jacob's teacher and I with a questionnaire, and according to publicmed.gov, the questionnaire contains 39 questions that determine that have three dimensions of the child's behavior of ADHD: attention, hyperactivity disorder, and defiant, oppositional defiant. After the questionnaire was completed and evaluated, he realized that he had high scores, and we both agreed on the same thing. The next step was to prescribe medication. Of these medications, there are several name brands, and two classifications of these medications are stimulants and non-stimulants. Both have fast-acting and extended-release formula. The most common classification to prescribe is a stimulant, which is Adderall, Concerta, or Ritalin. A non-stimulant is Strattera and Intuitive. Once the proper diagnosis and medical treatment is provided, the next step is to help the child in their daily lives with behavioral modification. The modification is a positive reinforcement and it is effective more with positive reinforcement than punitive measures. School and home are the two main areas to practice behavioral therapy. In school, it's necessary to check with your teacher to make sure that his behavior doesn't get out of hand. And each school and each teacher has their own way of rewarding and punishing. At home, I focus on the behavior that is problem bothersome with the family. My son is old enough to discuss rewards and punishments of what he doesn't like taken away, and most of all, be consistent. I have taken you through the steps of how to diagnose and treat my son with ADHD, and I hope the next time that you see a child misbehave and seem unruly, it's not always the parents' fault. They just can't seem to help themselves. A little patience and understanding go a long way. And remember, positive reinforcement really works. Thank you.